Lord, show me right from wrong. Give me light, make me strong. I know the road is long, make me strong.
A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Brothers and sisters, assalamu alaikum. Ladies and gentlemen, good night. Guess what? I'm back. I've been away for about, must be a year and a half, and for other duties, I had other commitments, so it's good to be back. So I'm back on Doctor in the House, the show that brings you the news, reviews, and interviews dealing with medical matters, local and international. So let's get down to the nitty-gritty. That's why I really like to thank my co-hosts, Dr. Joel Tilak Singh, Dr. Firoz Omardeen, Dr. Mohammed Rahman, and Dr. Safiya Mohammed, who held the fort while I was away. They're still going to be on, so we're going to be working on rotation. But as I said, it's good to be back. Well, what's been going on over the past few weeks? Well, the issue, of course, of the budget. Now, I haven't really seen the details of the budget, but I understand $6 billion have been allocated to the health sector. The question is, what is it going to be allocated for? I'm sure somewhere inside there, it's the Point Fortin Hospital, the Arima Hospital, but one of the big problems here is the issue of human resource, research and development, what kind of new services, how do we work more efficiently. But, you know, these things happen. We'll have to see how it goes. Certainly, I'd like to give condolences to the family of Clive Panton, a true patriot and servant of Trinidad and Tobago, who passed away over the weekend. He was a former minister, a former principal of Fatima College, and he really put in a sterling work to help Trinidad and Tobago. So he will be missed. All right, so let's see what's going on. In my introduction, the hurricane disaster that hit Barbuda, Dominica, the other islands, we are all vulnerable. I think we need to understand that. Trinidad and Tobago, we're lucky we haven't been hit by a hurricane for quite a long time. We talk about disaster preparedness. The question is, how prepared are we? If we are to be hit, will we be more resilient than what has happened to the other islands? But remember, those were massive hurricanes. So our heart and our help goes out to those islands. Many, many containers and personnel are going up to the islands to help them. So let's see how they can rebound. The flood in Trinidad after a little rainfall, well, that's how I suppose resourceful we are. Then, of course, internationally, they see up the crisis in Myanmar, where the Rohingya community have been driven out, have been murdered, and it's just another example of man's inhumanity to man. But that's what's happening all over the world. Let's go on to local medical news. Well, on the 29th of September, it was World Health Day and World Heart Day. Now, heart disease is a major, major source of morbidity, illness, and mortality, death throughout the world. And it's probably the #1 cause of death in Trinidad and Tobago, along with cancer. The onus is on all of us, especially as we're getting younger, older like I am, and lots of other people out there, to understand what are the things that you need to do to decrease your risk of getting a heart attack. And these are the things: controlling your blood pressure, controlling your diabetes, controlling your cholesterol, exercising, not smoking. And of course, what are the symptoms of a heart attack? Well, the classical thing is chest pain, but that pain can go to the chin, it can go to the shoulder, the left arm. And believe it or not, over the past few months, I've been hearing more and more of people who are a little bit older than me. When they have noticed that they are getting tired more easily, that's an indication to check your heart, because it could be that the blood vessels towards your heart are getting narrow, so you're not able to pump blood as it should. And people have had bypass surgeries, people have had stenting done just on that symptom. So people out there, keep listening to Doctor in the House and other medical shows. The internet is full of information. Go to your doctors, your GPs, your health centers. Make sure that all of those things that I mentioned earlier are okay. The issue of obesity as a big risk factor, we're going to be dealing with that in a little while, but that's a big issue. So please, please remember to think about that, about yours and your loved ones. Over the past weekend, there were 3 major medical meetings. One was on obesity and metabolic syndrome, and that's actually going to be what we're going to be discussing a little later, because it's a massive epidemic throughout the world right now. There was also another meeting on Caribbean hem-oncology, that's cancer and blood cancer as well, and plus there was a diabetes meeting. All of these were held in Trinidad, and a lot of medical information was put out. Now, researchers have shown that they can actually try to control malaria by controlling the mosquitoes that carry the malaria. Believe it or not, over 400,000 people are killed a year, a lot in Africa, because of malaria. So what researchers have done, they've looked inside mosquitoes and implanted in the mosquitoes a certain bacteria that causes the mosquito unable to carry the malaria organism. It's interesting, and hopefully if that works out, maybe they can do some technological advancement in terms of dealing with dengue, Zika, chikungunya, all of those other things. So technology is going, fast there. Now, scientists may be on the brink of a new strategy to prevent blindness, and that is blindness caused by glaucoma. Now, they found a naturally occurring protein that affects the eye from having glaucoma. So the team found a protein called neuroserpin, and it plays a key role in the health of the eye. But it seems that this protein is inactivated in glaucoma. So they suggest that their findings may lead to much-needed strategies to prevent and treat the disease. So the issue with glaucoma is the pressure in the eye increases, and as the pressure increases, it damages the nerve. So again, like pretty much everything in health, prevention is better than cure, because in glaucoma, if you lose your eyesight, you can't get it back. So you need to be aware of when you're having visual problems, that you go to your doctor and you get it seen to, literally. Now, interesting for all our diabetics out there, the Food and Drug Administration in the UK, they have okayed a device called no finger prick for diabetes, because that's one of the major issues with people testing their diabetes and their glucose levels. They have to stick their finger, test it. Now, a group called the Freestyle Libre Flash Glucose Monitoring System has a small sensor wire that's placed beneath the skin surface. So this continuously monitors the blood sugar levels. So people who are diabetic can just wave a little mobile reader, maybe it might be in your cell phone, you never know, and that will automatically give the result at your sugar level. And the system is actually approved for people in diabetes age 18 and over. Now, it is thought that after a 12-hour startup period that the wire can be worn up for 10 days. And I think that's going to be a little setback, especially for Trinidadians, because every 10 days you need to put back that wire. So I'm not sure how that's going to work out and the technique of putting in the wire. But the technology has started developing something. Now, the National Institutes of Health, the NIH, in collaboration with a pharmaceutical company called Sanofi, they have engineered an antibody that have protected monkeys from 2 strains of the HIV virus. And it is better than what is thought that the body produces naturally. So this engineered tri-species antibodies, it prevented infection by at least 2 different strains of HIV in cell cultures. So it is thought that these antibodies could actually play some form of preventative or curative role in getting the HIV infection. So this is what I spoke about, research and development. Those are the things that are driving all the new findings in health. And down to the mundane, I don't know if you all noticed that in the United States, Mr. Tom Price, who is the Health and Human Services Secretary, so he was actually responsible for health in the United States, has resigned. And why has he resigned? Because he was taking too many flights on private planes. So instead of taking commercial planes, hundreds of thousands of dollars were paid by the government for him to go on private planes for his various duties. And this raised a really storm, and our good friend, President Donald Trump, thought that this undercut his promise to bring accountability to Washington. And this is different now from Trinidad in that Mr. Price did the honorable thing and he resigned. I'm not sure when last a Trinidad and Tobago minister, when found doing something wrong, actually voluntarily resigned. I think that's a little bit of a issue in Trinidad. Now, one final study, researchers have found that people who sit too much, whether it's at a desk or the couch or in a car, they have a greater risk of premature death, cardiovascular disease, cancer, and type 2 diabetes. Now, I remember our good friend, Firoz Omardeen, telling me this a long time ago. And I'm not sure if he still does it, but he has a kind of funny stool in his office where he actually kind of stands rather than sits. So for those of you who live in a sedentary lifestyle, who work in an office and sit all day, please make sure you minimize that, make sure you do your exercise, because all the studies, what we call a meta-analysis, has shown that you have a higher risk of getting very sick earlier than normal people. And this is the final story, and this is coming out of Johns Hopkins, the Kimmel Cancer Center in Johns Hopkins in Baltimore. They have published a paper saying that they have developed a test, a blood test, that spots tiny amounts of cancer-specific DNA, that's genetic material, in blood. And they have used it accurately to identify more than half of 138 people with early-stage colorectal, breast, lung, and ovarian cancer. So think about it. They just did a blood test and was able to pick up in about 50% of patients these cancers. Now, the test, they say, is a novel way in that it can distinguish between the DNA, that's the genetic material from tumors, and other DNA that can be mistaken for cancer. So it's very interesting that this is happening. Again, this could lead to major breakthrough in terms of screening for cancers. And as we keep telling you all, that a lot of cancers, once we catch it early, it can be cured. It's when, unfortunately, and it's not a Trinidad thing, it's all over the world, people get symptoms of a cancer, and instead of coming to a doctor, they either go to an herbalist, or they are afraid to go to a doctor because they're afraid to get the bad news. And that is, it works against them. That the earlier you go to a doctor, the faster you will probably get healed and cured of the cancer rather than having to die of that cancer. So we'll take a short break, and I'll be back with you in a little while.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. Microlife, a partner for people, for life.
On all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Sun and Main Road, Cunupia.
Welcome back to Doctor in the House. Now, this, while I was away and people kept talking to me, this I think was probably the most anticipated segment of my show. And that is where we get some stress relief. So we crack a little joke and thing, So this lady is walking down the road with a baby, and she's rocking the baby. And she's saying, "Don't cry, Diploma, don't cry." So somebody's passing and hear her talking to the baby. And so the person stopped and asked the lady, "What did you call the baby? Diploma? Is that the child's name?" The lady said, "Yes." She said, "Well, why are you calling the child Diploma?" The woman said, "Well, I sent my daughter off to university, and this is what she brought back for me." Well, it's a little bit truth in there somewhere. Now, this chap called Tim, right? He was away on business. So he said, it would be nice to bring his wife a little gift. So he goes in a perfume shop, cosmetics. So the clerk at the counter shows him a bottle, and it costs $50 a bottle. Tim said, that's a little bit much. So she comes back and shows him a smaller bottle for $30. He said, that's still a little bit too much. I mean, it's his wife, eh? So the clerk now brings out a tiny $15 bottle. Tim said, "You know what I really like to see? I really want to see something really, really cheap." So the clerk hands him a mirror. And last but not least, this girl, this lady called Leah, she invites some family and friends to dinner. And at the table, she turns to her 6-year-old daughter and said, her 6-year-old daughter, Becky, and says, "Darling, would you like to say the blessing before we eat?" So the girl said, "But Mommy, I don't know what to say." Well, the lady said, "Well, Leah, Becky, all you have to do is repeat what you heard Mommy say." So at the start, when everybody's going to eat now, Becky bows her head and she says, "Dear Lord, why on earth did I invite all of these people to dinner?" We take a short break and I'll be back with you in a little while.
For the everyday lowest prices on all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Sun and Main Road, Cunupia.
Reduce the sugar chubby with the same great taste. Lots of magic fruity flavors, drink the more healthy way.
It tastes so yummy, chubby, chubby, yummy.
25% less sugar chubby. Be active, be healthy, drink lots of chubby. Kicking football, playing cricket, having fun in the sun. Reduce the sugar chubby, keeps you cool and refreshed.
It tastes so yummy, chubby, chubby, yummy.
25% less sugar chubby. Jumping rope, running races, have fun.
It tastes so yummy, chubby.
Drink the more healthy way. Sheikh Leisha Limited, the leading manufacturers of vermicelli, split peas, powder and grease-proof paper. We also manufacture a variety of paper and plastic bags. We have bags for French fries, sandwiches, popcorn, supermarkets, stores and much more. Whatever your needs, trust Sheikh Leisha Limited for quality products. Sheikh Leisha Limited, Warrenville, Cunupia, telephone 665-3336. Oh.
Milkana butter, an experience for your taste buds. Smooth, flavor-filled, rich, velvety butter. Milkana butter for cakes, pastries, pies, or just place it in any of your favorite dishes and add that rich buttery taste to all your meals. Why choose another? Look for the butter with flavor, the butter with the creamy richness in taste. Milkana butter, distributed by N.M. Ghani 2003 Limited, number 1 Industrial Lane, Champlain.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
مولاي صل وسلم دائما 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 مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين والفاري. At times I feel that the sun is hidden by a hazy sky.
A God's gift brought straight from the farm to your plate. Jaza Rice, with its premium range of basmati rice, helping you prepare your perfect, mouth-watering dishes just as you planned. Jaza Rice, blessings in each plate.
Every now and then we need.
This is a Pakistani product, and all over the world, at least try it once. And if it's good, please let us know. We need your encouragement.
Just a little time to breathe.
This is Doctor in the House, and I am Dr. Suleiman Juman. I'm your host on Doctor in the House, and now we've come to a very important segment of our show. But before we go into that, I've been asked to inform you that we are streaming live on the internet, and I think it will come, right, you see it there, www.ibntt.com, and it is also being streamed, and this is something new, on YouTube. If you can search IBN Master, so you can tell your friends, your relatives, and I remember sometimes people from overseas look at the show. Trinidadians who feeling homesick. So you can tell that those people all over the place that, you know, we are on air, we are on the internet, so they can look in and maybe can even call. So now we're going to interview two very special gentlemen. First of all, we have Dr. Nigel Bascom, general and bariatric surgeon, and Dr. Viren Singh, pediatrician and pediatrics lecturer at the University of the West Indies, based at the Eric William Medical Sciences Complex. So it's a little bit like little and large. If you could get a picture of both of them, so the viewers guess which one is the surgeon and which one is the pediatrician. So gentlemen, welcome to IBN.
Thank you.
So Nigel,
thank you very much.
First of all, tell us a little bit about yourself. So I know you live in Diego Martin. Are you originally from the West?
Yes.
So which school, which secondary school you went to?
Oh, the second, you'll be surprised. I went to Southeast Port of Spain Senior Secondary School.
Okay.
Yes.
And at which point in your studies you decided you want to do medicine?
Oh, I think I wanted to be a doctor since I was a child growing up, as my father will tell you.
Really?
You know?
So just what, some experience you had when you were younger?
He would always ask us, you know, son, what you want to be when you get big? And for some reason, the only thing that could have come out of my mouth was, I want to be a doctor.
Okay, very good, very good.
And of course, I've always liked doing things with my hands. And that is the main reason why I decided to choose the surgical field.
So you did medicine in Trinidad?
No, I did medicine in Cuba.
Okay.
I had to learn Spanish first. The first year is the preparatory year where you learn the language.
Mm-hmm.
Following that, you start your career, which takes about 6 years.
Okay, and how was the experience there?
It was excellent. The Cuban people are very warm and welcoming. And the opportunity to learn another language, and mind you, I studied medicine in Spanish.
All right, okay.
Right, so that was very interesting and educating. So the experience on the whole was wonderful.
Very good. And at which point you decided that it's surgery you wanted to do?
From the second year in medical school.
Okay.
From the second year medical
And
school.
you did the DM in surgery in Trinidad?
I did the DM here in Trinidad.
And you were one of the first few graduates at the local specialist program in Trinidad?
Yes.
Very good. And Viren, so what about you? You're a Central boy.
Yes, I'm from Montrose, Chaguanas, and background, same thing. I was primary school education in Montrose Vedic School.
Mm-hmm.
I'm proud of that school, as I am of Presentation College, Chaguanas.
Oh, you mean the other presentation?
I'm the other presentation. From there, went to Jamaica, started my undergraduate degree,
Okay.
and then completed that degree in Trinidad. That is how it was back
So which year you entered?
I entered medical school in 1988.
Right, so you were one of the last few?
We were the last class that was mandated to go to Jamaica.
All right. How did you enjoy your Jamaican experience?
I didn't like it in the beginning. I've been back to Jamaica because of UE again since. And maybe I look at it from a different perspective. Maybe the country has changed and maybe I have changed.
Yeah,
I've had experience to go into the UK after that. And maybe the out of home, away from home experience, it now brought me to reality what being away from home is.
Okay. So you're a pediatrician.
Yes.
And when did you decide it's pediatrics you wanted to do?
Before I wrote common entrance.
Wow.
Yeah.
how
I
did that
remembered
happen?
when I signed up to do A-levels, my A-level biology teacher, she saw that I was signed up to do maths, physics, chemistry back then. She asked me, what do you want to do? I told her pediatrics. It wasn't medicine. I told her pediatrics.
To the control room, he's not a pediatric surgeon, he's a pediatrician. So just
Pediatric medical doctor.
Yeah, medical.
We've given up the blades a while ago.
All right. So you were clear in your mind you wanted to do
Yes,
pediatrics.
correct.
And where did you do your postgraduate training?
I did all my postgraduate training in the UK. I've had 2 periods of time in the UK, that is between 96 and 98, and then I went back between 2001 and 2007.
Okay. And you did the postgraduate exams, and what brought you back to Trinidad?
Home. This is my home country, and this is where I need to make my country, I would like to make my contribution.
Absolutely, absolutely. All right, let's start from the starting. Over the weekend, both of you participated in this obesity and metabolic syndrome meeting at the Hilton. One of the problems is that this is starting in childhood now, the issue of obesity and all its metabolic effects. What tell me about it?
Well, we have been seeing more and more heavy and obese children, so overweight and obese children. And I think that is part of society's culture of seeing food as part of a reward system. We all see food to be something nice. When people go to the beach long time, we used to figure who carrying the frisbee, who carrying the football, and who carrying the cricket bat. Now, I am sure, who's carrying the curry duck, who's carrying the macaroni pie, and who making the bus-up shot.
You forget the KFC.
And, well, interestingly, I've just left the office there, and somebody, because of a hard day at work, he said he thinks he's going to reward himself with KFC. So food is part of feel good. And it makes all of us feel good. I mean, I'm not going to say no, I'm not immune, but I think we have to control that. And from childhood, we've become primed up to that belief and that culture where food is part of a reward system. It's worldwide, it's not localized here.
So you think that, I think psychologically that's definitely one of the issues. And of course, the second issue is that a lot of the unhealthy foods are just not easily accessible and cheap.
They are cheaper than the healthy food. I mean, if you try to look at trying to eat certain healthy foods, I mean, certainly the more protein-based ones, so those they are very expensive. And none of it seems to be produced locally, so we import it all, and that is a major issue.
So you have a fairly long history in Trinidad as well as UK. And over the past 15, 20 years, what are you seeing?
I have some interesting data that I've been collecting in Mount Hope from children who were diagnosed with diabetes in particular. So when we talk metabolic syndrome, it's actually a syndrome with many different conditions, but diabetes is the one that is most spectacular. And at this stage, so early from 2003 till 2008 or 2009, there was a very small but definite incidence of adult-type diabetes in children. These are heavy children who've now beaten their pancreas so much that it can't make enough insulin to sustain normal blood glucose values. From about 2009, and certainly by now, if somebody were to call me and say, hey, I have a new diabetic child, I could ask boy or girl. If they say it's girl, and if they say teenage girl, you have probably a 4 in 5 chance of betting, unlike 10, 15 years ago, that girl is an adult-type diabetes in a child.
So are you seeing it more common in girls?
I think type 2 has certainly shown a more robust increase among the girls than among the boys. There is a definite figure among the boys, but just not increasing and not as stunning an increase as among the girls.
I will come back to you, but Nigel, from an adult perspective, you've been around a long time, and I think the international figures mirror what's happening in children, in adults, in terms of obesity. What are you seeing? What's your experience?
Well, the reasons behind the obesity, as Varen mentioned, are very similar with the adults. Okay, it's issue with food, mainly. However, that is when we look at obesity. And as you know, we use the BMI, which is the body mass index, as a parameter to decide who needs to have a surgical intervention for their obesity. Because as patients know themselves, when you try all the different sorts of diets and pharmacological means to help with the obesity, it may work a bit. They may lose about 3 kilograms, 5 kilograms, which is a small percentage of their excess body weight. And as soon as they lapse on that form of conservative management, the weight regain is rapid and sometimes even a lot more.
Maybe you can cover a little bit. You have the obesity issue, and we know we need to do something about it.
Yes.
And what are the complications of people who are obese? And why should we do something about obesity?
Oh, well, the obesity goes almost hand in hand with diabetes, hyperlipidemia, high blood pressure. A lot of people suffer from sleep apnea. They suffer from severe low back pain, knee problems. Because of the diabetes, they go on to get complications such as diabetic retinopathy, diabetic nephropathy. And there are also a host of cancers which are related to obesity, such as breast cancer, uterine cancer, colon cancer, gallbladder cancer, pancreatic cancer, you know.
So all these studies show that obese people have higher morbidity and die earlier.
And they die earlier.
So I mean, so to our viewers out there, all the data is clear. It's absolutely clear that once you're overweight, your BMI is over 30, over 35, there are a host of complications that you are going to experience that's going to affect your quality of life and is going to affect you from being alive to see your children graduate, from seeing your grandchildren grow up. And this is when I see patients like that, I have to emphasize how important this issue is. Now, Tafiri, let's get back to you. I read at one point in time, if you have an obese child, even if you lose the weight somewhere along the way in your growth spurt, it tends to predict that you will become an obese adult. Is that correct?
I don't know about the lose the weight during your growth spurt because, you know, the whole idea of baby fat disappears, that's a myth.
Really?
Okay, people don't lose their baby fat. That is unusual rather than the usual thing. The baby fat was there generated because the whole food paradigm and the whole feel good, and that doesn't disappear. And it takes serious retraining of your brain and your thinking and your attitude towards food. I don't want anybody to feel food is bad, but food is food. It's not part of our reward system. It's simply something that we need to eat in order to stay healthy and be alive, but not part of our reward system.
So are you trying to tell me obese children are parents' fault?
No, I'm trying to say obese children are, one, a familial issue, and two, a society issue now. Remember, those parents are part of a society. And society can't see that we're eating in a plate, and if there is space in the plate, somehow you're not eating enough. You have to fill the plate with food. And that idea of a plate that needs to be filled with food, no matter what size the plate, it needs to be filled with food, otherwise you didn't eat a plate of food.
So this epidemic of obesity and diabetes in children, we need to deal with the societal norms.
Yes.
And so when you see parents and they come in and the child is ill, the child is diabetic, what are your strategies in terms of getting them to lose weight and live a better lifestyle in general?
Well, I try to emphasize that the better lifestyle includes diet and exercise. Weight loss is because of diet. So I say the word diet, and I tell them I could repeat the word diet, 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 diet 95 times. We could talk about exercise a couple of times and then go back to diet, diet, and diet to complete up the 100 times. The exercise has other good health benefits, okay? Exercise, it tones up your muscles, it tones up your heart, it gets your good cholesterol higher, it gets your bad cholesterol lower, it gets your bones, your joints healthier, it lowers your blood pressure, it lowers your blood glucose, but it really doesn't do much for your weight. Your weight is really, for any of us who try to exercise and to lose weight, listen, we need to be in a gym 2-3 hours a day doing heavy intensity exercise, or up to 6-8 hours doing what most people could sustain. We don't have the time for that. These poor children in school, they don't have the time for that. So we have to get them into the habit of sufficient exercise just to keep other aspects of health. But then we must look at healthy eating.
But I could see the viewers out there, but this Dr. Crazy, what about a little bit of roti, boy?
A little bit of, listen, I tell people...
A whole diaper is too much?
Yes. That is not a little bit by definition, okay? And in fair fact, and I tell people, I actually don't tell people what to restrict in terms of food, okay? I have my personal restrictions. They are restrictions I self-imposed, okay? But I don't necessarily exclude anything. I think things in moderation are okay. What I try to get people to do is restrict calorie consumption in liquids. I tell people no liquid calories. I think if people could just...
No sweet drink.
No. No, that's what people hear, right? But that's not what I'm saying. I'm saying no liquid calories. And I am going to put the fruit juices. I'm going to put whether it's sweetened or unsweetened. I'm going to put the sodas, the pops. I'm going to put all... If you turn the bottle and you could read any calories in that, I think it's wrong to consume. And I'm going to put milk in that. Without personal hesitation, I will put milk in that too, and milk-based drinks. I don't think we should be consuming milk-based drinks once we go past infancy.
So you want to always punch people to go out of business then?
I don't want them to go out of business, but you know what? A glass of juice or a glass of milk is equivalent to the amount of energy you're putting in your plate of food. And I just think if you sacrifice that glass, you could actually manage your plate of food a little bit more liberally, but still consciously.
So on a practical thing, apart from water, what can they drink? What should they be drinking?
I would have to say water at this stage. I'm going to make a statement that I have looked at artificial sweeteners and I cannot find, I particularly look at the American Diabetes Association website on artificial sweeteners, and they still say up to last week that it's okay for weight management and for causing slower rise in blood glucose, okay? Other people, and I'm hearing more and more people shouting, whispering, and saying that artificial sweeteners are not good for you. So I don't want to make a positive comment on it. I use them myself, but I don't want to tell people I endorse it. I think if you're going to make the change, go gung-ho, drink water.
What about freshly squeezed juices at home?
It destroys the fiber. There is no fiber in it, and fiber is an important part of a meal.
But from a caloric point of view?
From a caloric point of view, fruit juices are all the sugar water from the fruit minus the fiber. It's like taking... It's essentially the difference between taking fully digested flour, for instance, which is down to sugar, glucose, and consuming glucose as opposed to consuming flour.
All right. I can see people shaking their head out
And
there.
I can imagine people do, okay? Because we have a culture of thinking you have to drink a glass of juice, and that juice has vitamin C and this and that and the other, and it's good for you. I have found evidence to say otherwise. The conference yesterday, a dietitian in Barbados was very, very strong about the term that children should not be consuming juice and any sweetened beverages or any beverages that actually have what she called empty calories in it.
All right, Nigel, let's go on to you now. All right, so you have an obese patient now, and you've done everything. What are the criteria that you would use to determine that they need bariatric surgery? So let's just tell the viewers what bariatric surgery is.
Okay, well, bariatric comes from the Greek word baros, which means weight. So it's basically weight loss surgery. And it involves rerouting the gastrointestinal tract, either by different methods to aid in weight loss. Bariatric surgery involves two components, a restrictive component and a malabsorptive component. The restrictive component involves making the stomach smaller, and the malabsorptive aspect of it involves when the food reaches the small intestine, it reaches the small intestine at a certain level where absorption is limited. And hence, we have weight loss taking place. Now, the aspect of metabolic surgery actually came about on the heels of bariatric surgery when we realized that people who have metabolic syndrome, which involves the diabetes especially, as well as hyperlipidemia, hypertension, etc., their comorbidities, meaning these same diseases, went into remission. They became a point in time where they didn't require any medication. And this happens very early in the early post-op period. Within the first month, people who are diabetic can actually come off their diabetic medication.
So, coming back to this thing, what are the criteria you use?
Okay, so the criteria we use for bariatric surgery with respect to obesity is the patient's BMI. That's the body mass index, which is very easy to calculate. You at home can calculate it once you have a scale. You weigh yourself in kilograms, and you divide the weight by your height in meters squared.
Or you could go to a pharmacy.
Or you could go to a pharmacy and have it calculated for you. Once you have a BMI of 40, you are in the category of morbid obesity. And even if you have no other illness, you classify, or should I say qualify, for bariatric surgery. A BMI between 35 and 40 is classified as severe obesity. Once you have an additional illness with that BMI, when I say an additional illness, I'm talking about diabetes, hypertension, you qualify for bariatric surgery. There are other BMIs above 50, or should I say, once your BMI is 50 to 60, that's known as super obesity. And if it's above 60, it's known as super obesity.
So there are many levels of obesity, but all of them need to be addressed in one way or the other, whether it be medical, whether it be surgical. So ladies and gentlemen, we're talking about obesity and the epidemic of obesity in childhood, in adulthood, what can be done to prevent, what can be done to treat. We're going to take a short break, and when we come back on air, we're going to open up the line so you can have a chat with our doctors. See you in a little while.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Sheikh Leisha Limited, the leading manufacturers of vermicelli, split peas, powder and grease-proof paper. We also manufacture a variety of paper and plastic bags. We have bags for French fries, sandwiches, popcorn, supermarkets, stores, and much more. Whatever your needs, trust Sheikh Leisha Limited for quality products. Sheikh Leisha Limited, Warrenville, Cunupia, telephone 665-3336.
For the everyday lowest prices on all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Southern Main Road, Cunupia.
This is Doctor in the House. I'm Dr. Suleiman Juman. We're talking to Dr. Nigel Bascom, General Surgeon and Bariatric Surgeon, Dr. Viren Singh, Pediatrician. We're talking about obesity. We're talking about what can we do to prevent it. We're talking about what we can do to treat it, because it is causing massive, massive problems, not only in Trinidad, but all over the world. What we're going to do now, we're going to open up the telephone lines. The producers will put the numbers on the screen. Remember, when you are patched in, take off the volume, put your TV on mute, because we're going to get a very bad feedback. So remember, be precise, be concise, say what you have to say, ask a question, and then our experts will try to answer it and address it. So the lines are now open. Viren, you mentioned something, and maybe you can explain to our listeners, what is the metabolic syndrome?
The metabolic syndrome is a syndrome is a group of things that frequently found together. And metabolic syndrome is where you have obesity. You have something called acanthosis nigricans. So obesity goes with overeating. Overeating goes with producing too much insulin. Producing too much insulin goes with becoming accustomed to the insulin, so the insulin is no longer effective, so you have to get more and more insulin just to get that. So they have these things called acanthosis nigricans. You'll see some darkening, thickening skin around the neck. It starts in the back and it comes straight around as it gets more and more severe. Then insulin resistance, diabetes, high blood pressure.
Hold on, yeah. We have a call from the town of the Princes. Princess Town, you're on air.
Hello.
Hi, you're on air.
Hi, good night.
Good night.
I called to talk to the doctor about the bariatric surgery.
Right, Dr. Bascom, yeah?
Yes, good night, sir.
Good night.
What I want to find out, my BMI is 38. The doctor offered me to do it, but I said no. But what I found out is that I have enough problem. I lose weight, I put it back on. I lose the weight, I put it back on, and so, you know, sort of a yo-yo sort of thing. And, but I just wanted to find out more about it, like in terms of when you do that, how do you eat? Do you still eat like diet foods or your regular foods, or, you know? That's what I want to find out.
All right, thanks very much. Let's have one question before you hang up. Do you have any other medical issues, diabetes?
Yes, I have diabetes, hypertension, high cholesterol.
All right, so you have the full gamut of stuff.
Yeah.
All right, so listen on the TV now. Dr. Bascom will answer the question. Thanks for calling. So this is a concern, a real concern that a lot of people
will have.
And a very
good question. So Dr. Juman asked you a good question because that puts you into the category of severe obesity, your BMI being 38, and you have a comorbidity, well, multiple comorbidities, therefore you more than fill the criteria for bariatric surgery. And this bariatric surgery will indeed, you have a more than 85% chance of your diabetes going into remission, your hyperlipidemia becoming rectified, and your high blood pressure becoming controlled to the point where you don't need to take any medication for any of these diseases once you have the surgery. At this point in time, in adults with the BMI that you have, diet really doesn't help. We do nutritional intervention really to prepare you for the operation, where we put you on what you call a ketogenic diet, which is mainly vegetables and protein to help shrink the liver to assist in the operation. And following that, you go on a regime.
So after the surgery?
After the surgery, you go on a regime of liquid diet for the first 2 weeks, pure diet for the next 2 weeks, and then you gradually start back your solids. And we also put you on high protein shakes, and we replace your micronutrients, vitamins and minerals, and so on with supplements. Remember, because of the restrictive portion of the operation where we make the stomach smaller, you will not be able to eat as much. And don't worry, you will not feel hungry. So you will not be starving. But we will give you certain nutritional supplements that will maintain your nutrition.
All right, so now, you mentioned that there's an 85%, in terms of weight loss, most will lose weight, but there are some people who will put back on weight. Is that so?
That is indeed an issue where we have weight regain, and weight regain can be due to multiple reasons. And one important one that we recognize is something called binge eating, because people may still binge eat, and could cause their pouch to stretch. So that restrictive aspect fails because of how much they eat.
So you have to have some discipline.
So you have to have discipline. It's important to have discipline. Also, what people tend to do is they graze, something they call graze eating, where they eat constantly all day. And the term comes from, you have a cow grazing, eating grass all day. So, you have people who just constantly eat and eat and eat small amounts so they don't feel any pain or their pouch wouldn't stretch, but they can regain weight.
Now, the other thing from a technical point of view, this is done laparoscopically.
Laparoscopically.
You want to tell them a little bit about that?
Okay. Laparoscopic surgery or minimally invasive surgery involves making small incisions on the abdomen, about 1 centimeter in size and even smaller. And we put what we call ports at those points. and we look on the screen, your tummy, the inside of your tummy is filled with air, carbon dioxide gas, and that creates the space for the surgeon to do what he has to do while he looks on a screen. And that is how the surgery is done. That way, you recover faster. There's less pain after the operation. You can be up and walking the same evening if you had your operation in the morning, you know, so recovery is much more hastened than if you had your operation open. In fact, doing open operation on these patients is prone with significant morbidity and suffering for them because of pain and other complications like infections. They can't get up, so they have a higher risk of getting clots in their legs.
So there are no major cuts on the belly. So I would, to the caller from Princestown, I would strongly recommend you talk to your doctor again about it. You seem to be an ideal candidate, and I think you can benefit significantly
Absolutely.
From the procedure. So talk to your doctor, and he can make the appropriate referral. Viren, let's come back to the metabolic syndrome issue. What are the other components of the metabolic syndrome?
Diabetes, high blood pressure, low amounts of your good cholesterol and high amounts of your bad cholesterol, and also high amounts of triglycerides. So those three together we call dyslipidemias. The other things that people are not too aware of, so snoring in the night, okay? So these people, they're so heavy that they actually obstruct their airways in the night. And they have what they call an obstructive sleep apnea pattern. And those would tend to be the initial manifestations. And they don't sound too bad, okay? But when you think long term of what those cause, they cause real problems later in life. And when you have diabetes 10 years and hypertension 10 years, you end up with big chance of heart and kidney trouble. If you are, if I get diabetes at my age 10, 15 years from now, I am probably ready to retire. I've gone past the most economically productive time in my life. I still have things to do, but not economically in terms of benefit in the country. But if you take a 15-year-old child, give them 15 years, that's 30. They're in the prime of their existence. And if they're going to then be thinking about the diabetic or diabetic complications, let's be honest. Our setup locally, we have the highest rate of amputations in the world, in Trinidad, in the world, okay? Actually, it's in Tobago, not in Trinidad, but nationally, per 1,000 people living. We don't really have setup for people in wheelchairs. They don't even get wheelchairs, okay? And we don't have the public setup for wheelchairs. Ramp access, ramps into public buses, go to the supermarket. In foreign countries, you see people with little things could attach. Over here, you have to beg somebody when you go to the grocery, get me such and such. Okay, strokes, kidney failure. We dialyze maybe 100, 120, maybe 150 people at most in the hospitals. And if you think 1/3 of diabetics, and according to figures quoted, we have 160,000 diabetics in Trinidad.
So that's what, about 10% of the population?
It's 16%.
16.
And if you think 1/3 of them will have kidney failure, and even 1/3 of that 1/3 need to have dialysis, we're not even close to that number. And kidney failure is, like, to me, a medical difficulty to live with. Really, you don't ever feel good. Diabetes, hypertension, you know, cataracts and eye problems, blindness. Diabetes, again, is the leading cause of blindness, acquired blindness worldwide. Do we have good screening here for diabetics? No. If you think 160,000 people need to be screened every year, that's an astonishing number per day, needing to be screened every day of the year. Okay, we're not set up to deal with this sort of thing, and really, I think our country as a whole, society, has to try to break a grip from this and take hold of this condition before it cripples us. It's already, they've quoted figures like 3.5 billion per year spent just in metabolic syndrome. And could we continue to afford that? I don't know what happened in the budget today. There's budget presentation today. 3.5 billion, that's probably going to be more than half the health budget.
That's another practical issue, that issue of the economic effects of metabolic syndrome, not only on the individuals, but on the nation.
But do you think what is the cost of all those individuals going to a hospital, clinic, or their doctor 3, 4, 6 times a year, taking a day off each time they have to take the day off to go to clinic? That is not even a calculation that we pay attention to. Okay, so day off work, 160,000 people, 1 day, 6 times a year, that's 1 million days loss of work. There's a lot of days loss of work in 1 million days and 365.
And you even start talking about the national holidays.
Yeah. No, there's a reality. So the economic burden of these conditions are far more than anybody could even perceive, fallacy dollars and cents spent on drugs through CDAP or through the hospital that you end up pocketing to pay your own.
From another practical point, Nigel, the issue of bariatric surgery, is it available in the National Health Service?
Well, unfortunately, because of lack of resources in the public sector with respect to the instruments and the consumables that are required to do these surgeries in the public sector, they are not being performed anymore right now. They were being performed recently in San Fernando as well as in Eric Willis Medical Sciences Complex. However, I think we have to curtail on it because a lot of the consumables we use for that, we also use them for cancer cases. So we have to give priority, unfortunately, right now to channel those resources into the other diseases.
It's a real vicious circle then.
It is. And I just want to piggyback on what Dr. Singh was saying with respect to the metabolic syndrome. It is now accepted that surgery can be done for people with metabolic syndrome with BMIs less than 35. So you don't actually have to be obese to qualify for surgery any longer.
Okay, so in that case, what would be the criteria?
As long as you have diabetes, especially diabetes, and to date, studies has only been done on people with BMIs as low as 27. Okay? But many centers are actually doing it for people with BMIs between 30 and 35.
I feel that there is a lot of evidence that people of our ethnic background, so a lot of these studies done on BMIs were done in first world countries that had resources to develop these studies, yes, and published this work from time incarnate long time ago. So the standard BMI is based on a Caucasian dominant population. We know that the person who's most resistant to the metabolic syndrome is the slim, tall, Caucasian male adult. And any departure you have from that 5 means that it adds a risk of insulin resistance and metabolic syndrome. Asian populations in particular are known to be what you call physically slim, anthropometrically slim, but metabolically obese, meaning they actually get metabolic syndrome at a much slimmer size.
Okay, so different kind of figures.
Yes.
Have you ever called up from Tunapuna? Hi, good night, Tunapuna.
Hi, good night.
Hi, good night.
How are you, Gwenda?
Go ahead.
Okay, I have a question, right? I am a person who's hypertensive. What I want to find out, is there a cure for high blood pressure? How can you manage this? Because my pressure is always at 97, 100 and up. No matter what I do, even with the medication, it don't go down to 80-something. If I use herbs in the sense of the moringa, it would go down, but then it would go back up. Is there anything that I can do to help with this blood pressure?
Are you overweight or anything like that?
I am at about 154 pounds.
What's your height?
I'm 5 feet, a few inches in height.
Yeah, a little bit overweight. So that's one thing you can do. The other thing is, have you been seeing your doctor for your hypertension?
Yes, actually, I am, and I was on Lasix for about a week or two, and he did trying to see if that can help.
All right, so what kind of blood pressures you have again?
Like, with, on the, let's say between 97 to 100, up to this one, it was like 112.
All right, well, you're supposed to have two figures. The top one, the systolic, and the lower one, diastolic. You have do you have a blood pressure machine at home?
Yeah.
And what are the two figures? When was the last time you checked it?
I have it written down. Every day that I check it, and it normally would range within 160, 156 over 100.
Right, okay.
150
good.
over 95.
Okay. All right, well, we'll talk briefly around it. Well, we are not really physicians in terms of who deal with high blood pressure per se, but we will talk around it and what you can do. All right, so thanks for calling.
Okay, no problem.
All right. So, I mean, from the issue, I mean, she needs to lose weight. That's the number one thing. And things like salt restriction.
Yes.
To the viewers out there in the medical field, what we look at, the top figure should be below 140, and the bottom figure should be below 90. Anything above 140 over 90 is kind of deemed high blood pressure. Now, the other thing which I know a lot of patients have to understand, you cannot do one blood pressure reading and say you have high blood pressure, because the blood pressure varies during the day. And what you need to do is get a very good blood pressure cuff, and I recently heard about a very good one that gives reliable reading, the Omron. I don't have any shares in Omron. I'm not sure Inshan has a blood pressure cuff that he sells, but you need to do the blood pressures at various times, about 10 readings over different times, and see what the general trend is. But certainly if it's over 140 over 90, you are deemed to have high blood pressure. And there are things, there is no magic cure. She mentioned moringa. Dr. Singh, tell me about moringa. What do you call it?
Saijan. Yeah, I have some in my car right now, okay? So grown from my garden. I don't know, it seemed to be no wonder drug that just popped out of the blue. I mean, there was a whole conference the other day on Saijan based somewhere in Trinidad. I didn't get the chance to go to it. I actually don't know about the medical. I'm seeing the tea around. People beg me when I prune my plant. People taking the leaves, people taking the flowers, people want the Saijan, they're grinding the leaf, they're cooking the leaf. My mom said she used to cook the Saijan, not her parents used to cook the Saijan, and the leaves used to taste, well, green, like bush, you know, and I have no problem with Saijan. I actually quite like it, but I don't know specifically about the medical benefits outside the benefit of it being a vegetable, a poor calorie vegetable rather than the more high calorie, high dense things.
Nigel, do you have any contribution to the hypertension issue? She's not only obese, not...
but if, from what she said, if you do her BMI, I'm sure she'll fall between 30 and 35, and probably even over 35, which will put her in a category for
but I think
metabolic surgery. So you know, now when we're talking about treatment of the metabolic syndrome, we prefer to use the term metabolic surgery as opposed to bariatric surgery.
Fair enough. All right, we have a call from Karanaj. Hi, good night, Karanaj.
Hello?
Hi, you're on air. Go ahead.
Good night.
Good night.
I'm trying to find out if you all have anything to prevent you from snoring in the night.
From snoring?
Yeah.
All right, well, that's my field. All right. No,
your field?
Yeah, that's right. So an ENT surgeon would deal with snoring. Now, all right, so if you listen on the TV now, I'll just kind of go through a little bit about snoring.
Okay.
All right. Snoring is due to obstruction of the upper airway. So anywhere between the nose down to the throat here. If you are having obstruction somewhere there at night, you are going to snore. Now, one of the commonest features to link up with what we are speaking about here is that as you get older and as you put on weight, you will snore. And the simplest way to think about it, if this is your breathing passage, when you start to put on weight, you start to deposit fat inside the breathing passage, so it gets narrower. And as it gets narrower, you're going to have more difficulty breathing. The tissue is going to vibrate. You're going to have snoring. And if that continues to happen, you can actually cut off your oxygen levels at night. And you develop what we call obstructive sleep apnea syndrome. Now, this in itself is a big contributor to the morbidity and mortality of obesity, in that you cannot function properly, your blood pressure goes up, you have heart problems, you have vascular problems, your lungs, and there are studies that show that people who have obstructive sleep apnea have a high incidence of suddenly dying in their sleep early in their life because they're struggling to get air in when they're sleeping. So snoring can be simple snoring, that is, you're not cutting off your oxygen levels and you're just bothering your wife or your husband. But as you get worse, in terms of the obstruction gets worse, you go off into obstructive sleep apnea, where it starts to actually affect your health. I have a friend who used to snore. Anytime he went to visit his friends in New York, he would go and sleep in the closet because he would be bothering them. But so snoring, anytime you go to see someone to be assessed for snoring, first we need to see where the obstruction is. It could be you have polyps in your nose, or in children commonly you have adenoids enlarged, tonsils enlarged. Sometimes your tonsils are enlarged. Sometimes your tongue is enlarged. Is it that your jaw is malformed, so it's pushing the tongue back? So snoring, you have to look where the obstruction is. And then the second thing is you may need a sleep study to see if you have obstructive sleep apnea. And if you have obstructive sleep apnea, things like weight loss, sometimes surgery is required. And sometimes the final scenario is whether you need a CPAP machine. That is, you go to sleep with a machine there, and it's pushing air in. And that's really reserved for people who really can't tolerate or don't want surgery. So yes, snoring is a very important factor, not only socially, but medically. And yes, there are options. So I would suggest to the gentleman who called from Carenage that you speak to your general practitioner, and he'll refer you to the appropriate ENT surgeon to address it. But it is, and it can be, a life-threatening problem. All right, let's move on to Maraval. Hello, good night, Maraval.
Yeah.
Can I go ahead?
Yeah, what's happening, I'm losing weight.
Uh-huh.
My diabetes is good, cholesterol is good, the blood pressure is good.
All right. How old are you, sir?
I'm 80.
80. And how much weight you've lost in the last 6 months?
Yeah, well, I lost 6 pounds because in January I was 120, but before 120 I think I was 130 something. Anyhow, in January I was 120. Now I'm 114.
All right. If you listen on the TV, we'll just do a general discussion on weight loss and how we approach it. And this will probably fall into the realm of the general surgeon. So a patient comes to you. Now, the weight loss you talk about is not really very dramatic, because we see patients who kind of lose 20, 30 pounds in 3 months.
Yeah.
But how would you approach a patient who comes in with weight loss of unknown cause?
Well, the surgeon tends to be a little pessimistic in his thinking, because we have to think of the worst possible thing that you may have that could be causing the weight loss and look for that. If we don't find it, then we say, well, thank God, and we send you along your way, because there are some situations where the elderly may lose weight unexplainably, and we may look and find nothing. But first and foremost, we have to do investigations to make sure you don't have any cancerous condition, especially, that we can possibly treat, especially colon cancer, for example. That is one of the most common types, and we will ask you certain questions and do certain tests to make sure that that is not the situation. So my advice to you will be to go to your general practitioner at first, at least, and let them do the necessary examinations and investigations to make sure you don't have a major problem going on that you can probably treat and add 10+ years onto your 8AS.
Yeah. But what I like about that caller, he's looking at his health.
Yes, he is.
And a lot of people will not pay attention to that, and things happen and they don't go to the doctor. So I'd like to reinforce what Dr. Bascom has said, that you go to your GP, talk to him, and you know, you do some investigations, you take a good history to see, make sure there's nothing serious going on.
Yeah.
Okay, we're going down deep south now. Point 40 on the line. Hello?
Hi, good night.
Hi, thanks for calling. Go ahead.
Yeah, I have a little concern, okay?
Yep.
All right. Well, no, well, I'm not a person suffering from diabetes, pressure, anything like that, you know? But over the past year, I gained some weight, right? And, well, normally I just be going about busy, feeling a little drowsy and things, but I never really pay any mind to it. Just the other day, I went to purchase something so much, and while I was there, I just feel faint, and I sort of a faint away, you know? When I came home, after I started getting a little pain in my left shoulder, up my upper left shoulder, right? Gradually, by the time, evening time, by the time 6 in the evening, the whole hand was paining, you know? And I was feeling very faint. So I went to the emergency room or whatever, I told them what's going on. They didn't really tell me what happened to me, you know, and while I was there, well, they gave my injection. When they gave me that, they asked if the pain stopped. The pain didn't stop. No, I'm not a person suffering from sugar, pressure, anything like that. Eh? Right. And while I was there now, he, when I went back in, I told him, well, I'm still having the pain, and I started to feel real drowsy and, you know, fadish away. So what went on, he gave me 4 aspirin. Now, I'm not sure, but I'm not sure about how aspirin does take, but I don't think 4 aspirin is a dose. I believe, you know, so I was a bit timid to take it, you know. Well, I took it because I asked him, he didn't tell me anything what's wrong with me, eh? He gave me the aspirin, I took it. Then after he gave my other injection. Well, that's one knocked me out because I was totally cold. I am spending the night in the hospital. I got up around all 5 the next morning.
Right.
You know, and all he tell me that's how if you have stress or if what's going on, why I have this, because he did all the other tests and he see that everything else was good. So now I sit down at home here, but I still baffled because I'm still getting the fadish feeling, you know. I'm not getting the pain, but, you know, I'm still not feeling the way that I should will normally feel.
How old are you?
34.
All right. All right. I think that's a very interesting call that you made. All right. So first of all, the doctor, everything you described there, the doctor had to rule out that you were having a heart attack. Now, just an important point to all the viewers out there. Young people can have heart attacks, and people who do not have sugar, pressure, high cholesterol, with no risk factors can have heart attacks. So the doctor was right in assessing what's going on. However, you are absolutely correct as well, that if you are still getting the faintish feeling and stuff, that you need to go to your GP, and he needs to keep assessing you to make sure that there are no other issues that could be causing this fainting feeling. So it could be a problem with fluid, brain flowing to the brain. It could be issues with an inner ear problem. So I would strongly recommend that something has changed in you. So you need to keep following up until you get a satisfactory answer. So thanks for calling. We have Arima on the line. Hello, Arima.
Yes, still here.
Hi, go ahead.
I can speak now?
Yes, you can.
All right, I'm 22 years old, right? And I'm doing a lot of burping and yawning.
Okay.
I want to know causing that.
All right, interesting. I don't know if Dr. Bascom can answer that one.
How old you said you were?
22. Hello?
How old are you?
72.
72? Okay.
Can you hang up now?
Yeah, are you losing weight or you have a problem swallowing or anything like that?
Swallowing? No, not really.
And you're not losing weight?
No, I was losing weight because I had bacteria in my stomach and so on. Look, so everything is right. I did the test before and I did the test after, so everything is all right.
So do you get sometimes acid rash, like feel liquid coming up into your chest or your throat?
I have a burning in my stomach sometimes.
You're burning. Okay.
Yeah. It sounds like she has reflux.
All right, so if you listen, so Dr. Bascom thinks there's a possibility you might have reflux. So what should she do?
Well, again, you should visit your primary care physician, and they will send you on to a gastroenterologist or someone who does scopes because it sounds like you may need to have a upper endoscopy performed.
All right.
To see exactly what the problem is and then do the appropriate treatment.
So that sounds reasonable. Talk to your doctor. And the other simple thing sometimes could be is that you're just swallowing too much air.
Yeah.
It may be something simple like that. So, ladies and gentlemen, I think we're coming to the end of our show tonight, and we're going to have some final comments from our two guests. Dr. Singh, any comments to finish off today's show? Some words of wisdom. Oh, we have one final question from Dabadi. Hello, Dabadi.
Yeah?
You're the final caller for tonight. You want to go ahead?
Okay.
Go ahead.
Right. Hi, good night.
Good night.
I just wanted to find out from Nigel, Dr. Nigel, what is the percentage rate for the reversal of diabetes when the surgery is up? The stomach surgery is done.
All right, good question. Good direct question. Thanks very much.
Now, the rate varies depending on the type of procedure done and also the patient, the actual individual patient. However, the overall percentage is above 85% for a Roux-en-Y gastric bypass. That's where we do both the restrictive as well as the malabsorptive aspect of the operation. It's about 65%, more or less 45 to 60% in surgeries like the sleeve gastrectomy. That is where we do the restrictive component only by stapling off approximately 75% of the stomach. Those are the two main procedures that's done for the metabolic syndrome. There are others, but we tend to stay with those two mainly. And with respect to metabolic syndrome, of the two, the Roux-en-Y gastric bypass is by far superior to the
all right, good.
sleeve gastrectomy.
So, ladies and gentlemen, we're coming to the end of the show, and Dr. Singh, final comments?
I think that the incidence or the growing incidence of diabetes and metabolic syndrome in Trinidad and among children, it is an opportunity for our society, has to start with individuals, but society as a whole, to adopt some more healthy lifestyles. I've tried some of it, okay? I can't say I'm the paragon of what you need to follow.
But you look like a superstar athlete.
I do try to do my exercise, and that's probably what does keep me relatively toned. But I have to say that the weight side of my issue, it is because of ruthless attention to everything you do. And that is the only way that side of the issue could do. I don't feel it's something that's been damaging to my health. Actually, I feel better since I've tried to adopt some of those changes. I don't feel I'm spiting my body. I actually don't deprive myself from anything. But it really is. And I think if people actually look at what is being advised, it is nothing really spiteful, it's nothing really unachievable, and it's nothing really difficult to sustain. As I say, society hasn't promoted that, and it does mean that some people, listen, we all want to grow old. I want to grow old. I want to grow very, very old. Hats off to you, sir, who's 80 years old and listening and still looking after your health. I want to reach your age, and I want to reach here healthy. And the only way I can do it, it has to start with what I do for me. Okay, and I think that is what people need to do. Do it for yourself, do it for your child. Do it for your future generation.
Great. Dr. Bascom, final words?
Well, prevention is better than cure. So the best thing is to try and maintain an adequate lifestyle to avoid obesity and hence avoid the metabolic syndrome. However, sometimes we may end up in that situation where we may develop metabolic syndrome despite everything that we do, because as I said, we have people with BMIs of 27, which is considered normal, 25, and they develop diabetes which is difficult to control. And don't despair. We now have means of helping you.
Thank you very much, gentlemen. It's been a pleasure. I think we had some very interesting calls, and there are a lot of people out there listening to us. I think maybe if the takeaway message here is, as the good book says, everything in moderation.
Yes.
And bariatric surgery or metabolic surgery is not a cure-all for everything, but it's just another tool in our armamentarium to deal with the ravages of obesity and the metabolic syndrome. So, ladies and gentlemen, we had two very good guests today. And, you know, I'd like to give you a final comment, something for you to think about before we leave. And our thought for the week, and it's nothing to do with the budget or anything, but one of the penalties for refusing to participate in politics is that you end up being governed by your inferiors. Ladies and gentlemen, I am Dr. Suleiman Juman, and I'd like to thank you on behalf of my producers, my special guests, Dr. Nigel Bascom, Dr. Virendra Singh, for looking at Doctor in the House, for calling in and participating. We thank you for allowing us in your homes. We hope the information that we have given to you will help you in some way. And who knows, maybe the life you save could be your own. Until we meet again next week at 8 p.m. at Channel 8 IBM, I bid you all good night and assalamu alaikum. And it's good to be back.
At times I feel that the sun is hidden by a hazy sky.
A God's gift brought straight from the farm to your plate. Jazza Rice, with its premium range of basmati rice, helping you prepare your perfect, mouth-watering dishes just as you planned. Jazza Rice, blessings in each plate.
Every now and then we need.
This is a Pakistani product, and all over the world, at least try it once. And if it's good, please let us know. We need your encouragement.
Just a little time to breathe.